Everybody, this is Tracia Lynn Bolin with Worthy Runway to Life. And this is Friday, February 5th, 2021. And I am extra excited today because I have a beautiful woman here, which I consider one of my friends that I am so glad that we've met years ago through One Way to Life. This is Dr. Michelle Lynam. I think I said that right. Your last name.
Like
Lynam. Lynam. Yes, I'm sorry. It's Lynam. Beautiful. She's so beautiful. She is an anesthesiologist practicing in Virginia. After graduating a valedictorian, she attended MIT, and where her research discovered a gene at MCV and VCU for both medical school and anesthesiology training. She was chief resident and graduated with honors. Wow, this is a smart lady here we're talking to today. What an honor for you to be with us.
Thank you.
Providing human connection to ease the fears of nervous patients is what she loves about anesthesiology. She models for charity fashion shows like Runway to Life, and we're proud she's here with us, which raises awareness for mental health. She face paints, which affords her an opportunity to raise money for charities. And she creates smiles when she does that for so many people. And I knew they do that when they see her alone. She's married to a plastic surgeon, and they have 3 beautiful daughters. Her second job is managing their modeling careers on top of everything else she does. And I'd like to welcome today Michelle. And she is also, I wanted to include, she is Dr. United States. I didn't see Dr. United States of America. Look at this beautiful queen. Oh, and I wanted to show everybody her beautiful dress too.
Oh, yeah.
Did you want to show her that, or you want to show her?
Today is February 5th, which is Go Red, or Wear Red today, to talk about cardiovascular disease in women.
Oh, beautiful.
I'm always trying to, talk about science and medicine. So I have to stand up, and I've got this gorgeous Giovanni gown, and I am a very frugal shopper. So if anything I'm wearing, I got it on sale. So let me get up.
Oh, that is beautiful. I love your dress.
So pretty.
You look gorgeous.
All right, can you see?
Oh my goodness. That is a gorgeous gown, girlfriend. I love it. What is the print on it too? I love the design. What
a floral print?
Oh my goodness, that is
and
beautiful.
I tell you what, with this pandemic, being at home, it's okay to put your makeup on and dress up and buy. I've been working out at home. I transitioned from the gym, just working out in my bedroom, and sometimes I just need to buy new yoga pants for no other reason than just to make myself feel happy.
Oh, absolutely. So. Yes, of course you do. Yes.
Yeah.
Well, you look absolutely stunning, and your crown is just sparkling from the rooftop.
It's
beautiful. What is that? Lavender stone? That is just gorgeous. Yeah. Purple. Oh, that is gorgeous. Look at that. Look at her crown, everybody. That is just gorgeous.
And I have a huge head, and I'm tall, and it's a big crown, and I'll get into this later, but I'm completely new to pageant. So I lucked out that I was able to enter a wonderful system with a wonderful director, and she's been so supportive because I'm completely new to this. So she kind of encouraged me along.
Well, tell us about this pageant, since we're talking about that real quick. How did you tell us about Dr. United States of America? This is incredible. I want to hear all about it.
So it is under the Dr. World Productions organization, and it's a relatively new pageant system. And really the only way I know about pageants, a little bit from my neighborhood, we have Savannah Lane, who was Miss Virginia.
Yes, I know Savannah.
She is amazing. Beautiful. And she is, I tell her, you're gonna be president one day, because she is
she's very smart.
Such a great communicator. And then the Rudy family, I went to school with
Morgan. Yeah.
Right. So Morgan, of course, everyone.
Yes.
So I always idolized these wonderful women who are poised and great communicators. And although I love doing charity work, I don't have that communication skills. And I never thought pageants were right for me because, I can't get up on stage and sing and dance. I have no talent. Painting doesn't really afford itself well to doing it.
You have a lot of talent, doctor. You have a lot of talent.
So
how many women could say that?
With Runway to Life, which is an amazing organization, and I'm so grateful that I'm able to be a part of it. Where, as you probably mentioned before, they encourage people in the fashion beauty industry to pick up signs of people who are struggling and suffering, and either just lend an ear so they can talk to someone, or be able to, guide them in the right direction so they can get help. So
Absolutely.
it's such an amazing organization. And when you're backstage at the runway shows, there's people who may not feel comfortable sharing their mental health stories, but backstage they do. And I've had so many wonderful conversations, met so many wonderful people, like Jackson Scott and
Yeah.
Shane Siriano. And then a lot of the women who are involved in the Miss for America pageant system.
Mm-hmm.
So Courtney and Tiffany this year. So that's kind of how I met some of the pageant girls, and it kind of changed my perspective about what a pageant was. I just thought it was about, swimsuits and gowns and whatnot. And I realized it's such an amazing way that you can make a contribution to society. And the model coordinator, Jessica, she was the one who found out about the Dr. United States of America pageant.
Oh.
And she said, Michelle, you got to apply. And I'm like, girl, no, I don't. I am not a pageant girl. I don't have any talent. I cannot speak. I'm not interview quality. No. She kept pushing me. And actually, the director of the program, Diana Lawrence, she started nudging me too. You think, she was kind of like a friend almost, and talked me through it and like walked me through every step of this application process, which probably, was very easy for other girls who'd been in the system for many years. I didn't know what I was doing. And she was like, you are worthy. This is a good fit. And the more I thought about it, I was like, you know what, maybe I can do this. And because of the pandemic, I'm always trying to think about what are the positives of the pandemic. The positives were that this pageant was now virtual.
Right.
And it was something that I could fit into my schedule, because I wouldn't have been able to travel to Las Vegas or whatever prior to that. So we did most of the stuff online. I sent in my little bio, I answered some questions. I got to do a online runway walk. So I put on a gown that I got on sale a few years ago, and went with my mom, who's my biggest supporter and cheerleader. We went down to Maymont. So people who are from Virginia know that that's just the most beautiful garden in Central Virginia. And on my little iPhone, my mom filmed me just walking in the Italian gardens in my gown, and she snapped a couple pictures, and we were waiting for some graduates to move out of the way. So she snapped a picture that wound up being my photogenic. that was my picture that I submitted. I had nothing. I'd never had a photo shoot, nothing. I'd never, other than Runway to Life, had not done any modeling really. So that was the whole package. And then we had an interview process where Dr. Lawrence had some amazing judges, and it was 5 minutes. It was really intense. The first question was like, what is your biggest failure? And so
and what did you say? What is your biggest failure? You said,
God, what did I say?
This is all for doctors now, right? This whole pageant is just only
so yes, it's for women with doctorates.
Okay.
So any PhDs
or above. Yeah.
Right. So my doctor is a medical degree. So some of the questions were softer. That was tough. So
what did you say when you said was your failure? Could you find any?
I just talked about the struggles with passing board exams. So, my life has been, very different. The first half of my life was just studying and working hard. I am the child of immigrants. And so there's a thing with children of immigrants where they see how much their parents have sacrificed for them, and they kind of make their own sacrifice. And mine was school and working hard. And it wasn't until Runway to Life that I ever had anybody do my makeup. I mean, I'm not, never had my nails done, makeup done, and that stuff. So
really,
all of this has been just a huge treat. And the first year we had Runway to Life was really because of my daughters. They were 12 and 11. They got scouted through Facebook for a modeling agent called Kim Alley. She took them up to New York, got them signed big time. And then a friend of my husband, told me about Runway to Life. And that was their first runway experience. It was first year we were in the hotel. So it was a much smaller event, and they're 12 and 11. So I'm backstage with them. And every time I stood up, they were like, oh my gosh, you don't have your hair, your makeup done. And I'm like, it's because I'm not a model. And enough people said it. And I said, gosh darn it, this would be really fun. So I joined the runway the second year. And gosh, do I love being on the runway. It's so much fun.
Michelle, I remember you being out there. I remember us waiting and talking when we were went out to the runway, and you seemed like a pro. Nobody would ever know that you did not know what you were doing. I mean, you were so calm and collective about it. I mean, it was just a joyous experience. So you did very well. So you're natural. You're very natural. So it just comes natural to you. I think sometimes when God gives us gifts that we just fall right into where we're supposed to be sometimes, like sometimes he puts the right people in our path, and then we end up being where we're supposed to be and follow right along that path. It's a blessing, right?
You have frozen on me.
Yeah,
can you hear me?
Saw you for a minute.
Froze
Yeah,
on me for a
yeah.
second.
I just saw you. You were just in frozen mode. I think that was a moment we're just supposed to hold and just pause on that moment, right? That was a God moment, right? That was a God moment.
Yes.
Well, that's incredible. I mean, you've just done some amazing things. So what other things are you doing right now? What are you doing with your title? Are you, what is your did you have to have a platform when you had this, or?
So the foundations of the pageant are mentoring, education, and volunteering.
Oh.
So education, if you've followed me on Instagram or whatever, you'll see lots of information about COVID. So, going to MIT, you don't memorize a lot of stuff. You learn how to critically think, you learn how to do research. So I'm able to use that nerd background and my medical degree, because you have to be able to understand the language when you read articles about COVID-19, and I'm able to sort of digest it, and I try to put little bits. So early on, it was like, please stay home. And then it was, please wear a mask. And I still like making those mask videos and talking about face shields and masks with valves and whatnot. And then educate people about vaccines. That's really taken off lately, because so many people are so scared about it. And I am always open. Anyone who's listening, find me on social media. I will happily answer any questions you have. And if I don't know the answers, a lot of times I don't. I know people who are smarter than me, who are, you can find out the answers for you.
Are you still able to make appearances and do things like that? Or, I mean, like how are you able to impact with your title? Is it mostly virtual, or are you still able to get out?
It is mostly virtual. I do some like education at the hospital. I've met with some nurses and done some education. I was hoping to be able to go to the vaccine clinics, but they were trying to keep the numbers down there. The idea was like I could take selfies with people, but yeah. So there's a lot that I'm missing out on in the pageant excitement. And of course, Runway to Life was really scaled down, broken up into little pods.
Yeah.
So I cannot wait for this just to be over and I'm always talking about the positives about bad situations. And you know what? This pause in our lives is really going to make us appreciate all the things we had before. I mean, I'm sure you've looked back at old pictures and videos like, gosh, I didn't realize how wonderful it was just to be able to, go have tea with somebody, to have a, backstage conversation with somebody. So
gives us a thankful heart, huh?
It makes you really appreciate, what you have, and people who've not lost loved ones or gotten sick makes you appreciate, like, gosh, I don't need that much in life, but to have my health and safety and loved ones around me, it's a lot to be grateful for.
So what kind of things have you been through some things in your life, some challenges that have that maybe you think that that you've had to overcome, that maybe would be a spark of hope to others, that to let them know that they can make it through too? Because a lot of people have lost their hope over this last year, and they feel like they just can't find a way out. Do you have any words of encouragement or hope to help others just maybe think that they can just pull through, who are watching us, that maybe they can just give some words of encouragement?
So I think with this year, it's created a mental health care crisis for all of us. And I know when all this was starting, there was a lot of fear. And with my job, I do intubation. So I'm really, up close to people's vocal cords, and really puts me at risk. So I probably struggled in ways that were different than other people. So other people were like, gosh, I am going to be miserable if I can't see my family or my friends or go to parties. And for me, it was a struggle of, I don't have a mask. This is, I'm frightened. I'm anxious. I have all these worries. And even with the virtual schooling and my children, I see how it affects them very differently. So I think sometimes the conversation might not be about, this is making suicide numbers going up. This is making, you have to look at, how is this situation affecting people differently? So I have one child where the isolation has been very, very hard, and we've maybe just eased the rules a little bit for her. I have another child who, like, this is fine. I can call my friends virtually. I was doing that before. So the introverts have not had as hard of a time as the social butterflies. So I think we really need to tailor our conversations about how are things different and how can we make plans to help people differently. There are actually some more positives about this year. I spoke to my children's pediatrician, and they said that because schools were closed, kids weren't coming in with fevers. They weren't getting the sniffles and all that stuff. And they actually had time to go in their backlog and catch up on the mental health issues that their patients had, that they kind of brushed aside because they're here with strep throat.
That's true. Yeah. That's
and
good.
There were some changes that made telehealth much easier. So the insurance company said you have to be in person to be reimbursed, but there was some, I don't know the details, but there were some laws so that telemedicine became much easier. So a lot of these healthcare providers were able to go into people's homes and do therapy and sessions and guide people that way.
Yeah.
So
that's incredible. Yeah, I think everything put a new spin on everything and gave us a new perspective that we wouldn't have looked at otherwise. I think that's very good. That's good. That's good. So where do you think you're going from here, Michelle? Like, what's next? Like, after all this, when is your reign over with this title? Does it continue because
I was crowned in October.
Okay.
So around the fall, I guess.
So you're till this October 2021?
Yes.
And then what's after that? What's next for
I don't
Michelle?
know. I don't know. I mean, this is so. Let me have to talk about my parents. My parents are so awesome, and I owe them everything.
Hey.
My parents fled communist Czechoslovakia in the 60s. My dad was an MD PhD. He got a job with the World Health Organization to go to Tunisia because there was some political hubbub and all the scientific medical people left. So he and my mom went and they lived in Tunisia for a year and a half, and they had the time of their lives because things you don't appreciate when you don't have them. They were free for the first time in their lives.
Yes.
So they decided to stay for another year and a half. My dad had to learn about all these tropical diseases so he could take care of his patients. His patients would bring him a gift basket, but there would be dinner, which would be a live gazelle or rabbits. So she had a pet donkey. So these great pictures of them in their house, and there's a donkey and a gazelle, and now there's like 50 rabbits. So rather than return to communist Czechoslovakia at the time, they made a daring fleet to come to America. My mom and dad had just learned French. They actually thought about going to the Ivory Coast because they had to learn French to live in Tunisia. But my dad's med school friend was in Tacoma, Washington, and you need a sponsor. So they were able to come here.
Oh, I was born in Tacoma, Washington.
Okay. Oh,
cool. I love Tacoma. That's why. Okay, go ahead. Sorry.
Because of his PhD papers, they wanted scientists. So he had an easy time submitting and coming here. They left everything behind: his reputation, his jobs, education. They literally met in the darkness in Tunisia with the American ambassador. Didn't want to go to the embassy because they would get caught. And so they fled here. And it's really a lot of the reason why I love this country so much. And I appreciate, being an American and patriotic and all that stuff. So
he fell in love at the embassy?
No.
Oh,
that's why I love America.
You said they met at the embassy over there.
No, they met in Prague and they got married. My dad was a physician. My mom was working in the lab, and they met in the hospital.
Oh,
and I could talk for another hour.
A medical romance, right? No wonder you're in the field, right?
She actually wanted to be a ski coach, but her family was persecuted and she didn't have the opportunities that she would have otherwise. So fate brought her to the hospital where she met my dad. And then
Wow.
she's kind of the adventurer one. So she sort of pushed him to take this job in Africa. And then the job in Africa gave them that little window of opportunity to escape. And so they came here in the 60s, and then
Wow.
2 children. Both of us are physicians in town.
And how many brothers and sisters do you have?
I have a brother, and he is a physiatrist, does like pain medicine. There's just the 2 of us.
So your daughters are going to grow up to be in the medical field, right?
Probably not.
Yeah. No, really. Oh, I thought it was going to continue, right?
I don't know. I think Mirabella, the way she likes to argue with us, I think she'd be a good lawyer.
Oh, okay. Well,
And Gabriella has always wanted to go to dental school.
okay.
Because my husband actually has a dental degree, did an oral surgery residency. He joined my medical school class, and then he went on to do a plastics fellowship. So he's got like more training than I have. He's the smart one in the family.
Wow. Well, it sounds like you're all very smart.
Oh,
Sounds
thank you.
incredible. You guys make quite a contribution to society. It sounds like you help a lot of different people in a lot of different ways. So is there anything else that we need to know about Michelle and your family that we haven't heard yet, that we don't know?
Gosh, there's a lot you don't know. One thing that I going back to the COVID stuff, one thing
Yeah.
I do want to highlight, and probably one of the things that got me kind of passionate, is I lost my med school classmate, Warner Breen, last year. And she was in New York
Over
and-
COVID.
over COVID. So she was in her story is really what has motivated me to speak out and to talk about the mental health aspect of it. So she imagines the director in the emergency room in New York, and her first hurdle is she's now got to decide, where do these scant masks go? How do I protect my staff?
Yeah.
And I have heard some really terrible things that she saw. Don't want to repeat them. They're just so terrible and heartbreaking. She winds up getting COVID and gets so sick she has to take off some time. She physically recovers and drags herself back to the hospital, and probably has a combination of PTSD. She's the happiest, most outgoing person you could meet,
Mhm.
but she probably had some PTSD from what she's seen and the stress she's under, and there's so much fear and unknown. And new studies coming out that people who've recovered from coronavirus have a higher incidence of newly diagnosed mental illness. So it's not just the stress of the change in your routine, but there is growing evidence that the virus itself, or your body fighting the virus, damages blood vessels. And so any organ in your body that is fed by blood vessels, it's all of them, including the brain,
Yeah.
can be damaged. So her family, if you pull up her name and look at interviews, they strongly believe that she suffered some either permanent or temporary brain damage from having the infection herself. So she was at the hospital and struggling to the point where the administration says, you need to go home. She goes home and sits in her chair and cannot get out of her chair, like just physically, mentally cannot get out of her chair. And her family and her friends and her loved ones created like a chain to drive her. Everyone would take like one state and they would drive her back home to Virginia. And even though her body was healthy, she was not in a good place mentally. She had to be hospitalized, and went home, and her sisters were taking care of her. And people who talked to her, she seemed fine, and she wound up taking her own life. So it's just the most
Oh,
horrible
my goodness.
story. And I remember the moment I watched on the news, they said her name, my jaw dropped, and I just was horrified. So I think it's important that her name lives on, and that we take care of each other in a
Yes.
way that we can. So,
Nobody saw any signs even before that came about. huh?
well, I mean, she was not in a good place, but
Yeah.
the day before she was doing well and improving and whatnot. So I think it's a good message is, if you do have a loved one that has recovered, especially if they were sick enough to be hospitalized, the hospitalized patients have about a 1 in 8 chance of getting diagnosed with a new mental or neuro diagnosis.
Yeah.
So if you see some changes in somebody who's recovered, just remember, it might not be that they can't go to Florida on vacation, it could actually be a primary damage that, and we're still learning so much, but, feel free to speak up and get that
Yes.
person some help.
Yes, absolutely. That is so good, Michelle. And that's what Runway Life is all about. It is to bring awareness and to speak out and to not be afraid to talk about suicide and to bring mental health awareness to others. And that's why we get the conversation going, and we have these conversations to talk about these things. So we can stop it before anything like this would ever come about. So thank you for sharing that story. And yeah, that we need to have the conversation keep going. And that's what we even talk about on Worthy. We want to bring the fashion and beauty community together to have these conversations, saying, you know what, you're not alone. We're all in this together. We can have these conversations, and we're in it together. So thank you for sharing that.
Thank you. And it's so hard because you hear so often,
Yeah.
there is no sign. I just talked to them the other day, there's no sign. So it's definitely something that we can all use more training and education.
Oh,
And
yes, absolutely.
if anyone's had the pleasure of talking to Alicia Amser, she's just such a great educator
She
and
is.
speaks from the heart, and she does such a good job.
She is. I've been going through some training, and it is just an incredible. We have met as a group, as leaders, with each of our individual groups, Runway to Life. We have started going through these training classes to let us know these warning signs ahead of time and what to do and to help people. And it's just incredible. And I just can't wait as we just continue. And anybody who wants to go through these classes, I encourage you to get a hold of Runway to Life and go through these classes, and get a hold of Alicia. She's just a great resource. Runway to Life, period.
Amazing.
Get a hold of these resources, and they can help you and get the training you need to help others around you. Because, we all don't know everybody, but we each meet a different group of people around us, and we can impact those people that we have around us that can help. We might be the light to others, that might be the only light that they might ever see, So we need to be that light to them. For Jesus, it's important. So that's what we have to do. So spread the light, and we are the hope. And that's what we have to do every time. So that's what we're here on this earth to do, is to shine the light of Jesus. Thank you for sharing that about your friend. And I'm sorry to hear that about her. And thank you for sharing your story. Is there anything else that you have that we don't know all the treasures about, Michelle?
Oh gosh.
No, you have beautiful daughters. You didn't tell us about them either. All the things that they do. I know that they're supermodels. What else are they doing?
Yeah, that's been hard because a lot of the big shoots and shows are shut down. So it's slowed everything down. So
I bet your husband's proud. He's got a supermodel wife and 2 supermodel daughters. So you guys are out there.
I lucked out there. I was very fortunate that God brought me a wonderful man. He's a great father, and he's such a smart, brilliant doctor, and he's funny. So we have a good time together, and I'm very grateful that our paths crossed. And
how did you meet? How did you guys meet?
So he's from Delaware, and he went to University of Richmond, and he didn't know what he wanted to do. He sold cars for a couple of years. You'll kill me for saying that, but he went to dental school, and he loved dentistry, and dentistry is very artistic and you use your hands, but he wanted more. So he did a oral surgery residency, and he wanted more, and he joined my medical school class. And that's where I saw this new face in second year med school. And I saw this tall, handsome gentleman, and we started talking and seemed to get along fine. And he was a great support to me because he'd already been through his residency. So he could kind of guide me as to how to do a good job and learn and be good to my patients and the rest of the medical teams. So he then wanted more, and he went on and did a plastic surgery fellowship. I said, no more. He's actually the one who talked me into doing anesthesia, because we don't have a great exposure to it as students. And knowing me, he's like, I think you would love it. So it is really fun because it's very hands-on. You actually solve problems on the fly, and there's a lot of creativity that goes on over the years. People are always trying to MacGyver things and create new ways. But the main thing, which you touched on in the beginning, what I really love is being able to sit down with my patients before they go to sleep and talk with them and ease their fears and explain as much of the nerdy stuff as they want. I really love labor and delivery, oh my gosh, like there's nothing to compare to taking care of a mom. And especially if I do their C-section, get to see that little baby come into this world. It just never gets old. And I'm taking pictures because I like taking pictures. And
Oh, how wonderful.
if the mom and dad start crying, if the dad cries, I'm going to cry because they're just,
You're going to make me cry. Just thinking about that.
That is such a gift to be able to witness that.
Absolutely.
Be of service.
That's wonderful, Michelle. Thank you so much for sharing that. Well, if anybody wants to reach out to you or get in touch with you, would you be willing to give them a way to reach out to you? Are you on Facebook or Instagram?
Yeah. So
share that on here.
Michelle Vokac Lynam is my personal Facebook. I do ask if you friend me, send me a little message, introduce yourself, because I get a lot of friend requests on there, and I try to limit that to people who I'm okay with seeing pictures of my girls and stuff.
Of course.
And then my pageant system is Dr. World Productions, and my pageant page is Dr. United States of America. And then my Instagram is open to anybody. I do some silly stuff on there, and that's Doctor, written out, DOCTOR, model mom, because I'm managing my girls or being a model. They're really the stars there. And my I think my Twitter is also Dr. Model Mom. I don't go on there much. And my TikTok is also Dr. Model Mom. And I am way too old for TikTok. The kids do this, and, I don't know what I'm doing on there, but you can point out what I'm doing wrong if you get on there.
Thank you so much for your time today, Michelle. I appreciate it so much. And we really appreciate having Michelle on here today. Dr. Michelle Lynam. Dr. Michelle Lynam. And what a privilege to have her on Worthy today. And we appreciate it. Thank you so much for your time today, Michelle. It's great talking to you.
Yeah, thank you for having me.
I appreciate it so much.
Thank you. And I cannot wait till we get to be in person together, rocking the runway together.
It'll be so much fun. We had so much fun last time. I can't wait till we hit the runway and just I think we went White House Black Market. I think that's the one we were walking together.
And I think you did little boutique Firefly Lane, which is now
Firefly. Oh, fantastic.
I did that with my girls.
Oh yeah, I loved that. That was so much fun. We had so much fun together. I can't wait to see you again. And
please, anybody
congratulations on your new title too, by the way.
I'm up late. Anybody wants to send me a message and chat, either like nerdy COVID numbers, or just if you want someone to talk to, as a friend. I love talking to people and just, lay out your feelings and stuff. And I don't have training in psychiatry, but, I'm an ear.
That is so sweet. Thank you so much. And you hear it. She offered, so she gave your information. All right. Thanks so much, Michelle. Take care. It's great to talk to you.
Thank you.
Take care. Bye.